Please wait for some time as there was a problem with our. Everyone, please wait for 1 minute. Everything will be corrected soon. Good evening, good afternoon. 636th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Jessica Monteiro. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, and the second session is an international session which begins at 8:30 and up to 9:30, and from 9:30 to 10:30 local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again, and you can subscribe without paying any money. You can share it with your friends also. And sorry for the delay in starting the minutes, as there was some technical problem with our team, and everything is fine now. Let me introduce the guest of the day. As you all know, that it is none other than Dr. Jessica Monteiro. She has completed MD and is working as an associate professor, Department of Medicine, KLE Homeopathic Medical College, Belgavi, and BHMS from AM Sheikh Homeopathic Medical College, and completed Doctorate of Medicine from Sheikh Homeopathic Medical College. Currently pursuing fellowship in medical education, FIMI, from Manipur Academy of Higher Education. She has completed her MSc in psychology also. So she is working in a beautiful way in college, doing all work, including research work, and has presented so many session papers in international forums as well as the national forums. And Doctor has presented some of the brilliant presentation in this forum earlier. And today, Doctor will be talking about reflective practice in homeopathy, a big subject, a beautiful subject. Let us begin the session. We proudly welcome Dr. Monteiro, Jessica Monteiro, to this session. Welcome, madam.
Welcome, sir. And a warm good evening and a warm welcome to all the participants. Dr. Danesh, I thank you once again for inviting me back to this wonderful forum. And without any delay, I would start my presentation today. Today, I'm going to talk about a very simple topic, a probably new topic, and something which all of us have been practicing from day one in our clinics, as well as from the time we have started our educational journey. That's reflective practice in homeopathy. But today I want to throw light on the scientific and the logical understanding about what is reflection or reflective practice and how we can correlate it with homeopathy. So the objectives of my session would be the participants today shall know the basics understanding of reflective practice and its different models, importance of reflective practice in patient interaction, and role of reflective practice in self-development. So this is a very simple question. I think all of us by the end of the session will understand that yes, we all are reflecting. We all do the reflective practice. But how is it so important, and how especially it's important when we are practicing homeopathy and we are interacting with patients? Have you used reflection before? Since I am doing my fellowship in medical education, and most of my batchmates are allopathic super specialists who are a part of NMC, and it is very dominantly used in the medical schools, that is the MBBS. And when I was introduced to reflective practice or reflective learning, I realized and said to myself, this is what I have been doing, and this is what all of us have been doing. And per se, that has brought me back to understand how Dr. Harriman was so way ahead compared to all his contemporaries, and how he has put this essence of reflection in are homeopathic principles. So before I start, I would like to start with this quote by Richard Carlson, which says, reflection is one of the most underrated yet powerful tools for success. There's another quote which I really liked, that is by Dennis Derriton. There are three principal means of acquiring knowledge: observation of nature, reflection, and experimentation. Observation collects facts, reflection combines them, experimentation verifies the result of that combination. And all of you would agree to me, this is exactly what Dr. Hahnemann has done. When he was translating Cullen's Materia Medica, he reflected on what was happening. And then he experimented with the cinchona bark. And then the result of that combination is homeopathy has grown wide, and we are all standing here as homeopaths because of that reflection, what Dr. Hahnemann has put into practice or put into action. So I don't think so I'm wrong when I tell the homeopathy started with a small reflection by Dr. Hahnemann while translating Cullen's Materia Medica. Probably if he wouldn't have reflected, I don't know how things would have turned out. So that's how important reflection is, and that's how powerful reflection is. And we all do we all do practice reflection, but we underestimate it, or it is so many times underused or underknown. So today, my whole aim would be bringing to light to all of you present here on this forum what is reflection and how can we use it in our day-to-day practice. Let me just quickly go through the reflections or definition. In the background of reflection, Dewey is the one who during the 19th century or during the 1910 started with this whole reflection. And he defines it as an active, persistent and careful consideration of any belief or supposed form of knowledge in the light of the grounds that support it and the further conclusion to which it tends. That means, he means that reflection as thinking deriving from puzzlement experienced in a definite circumstances and as an important way of learning by gaining experience. So, of course, this looks to be a complex definition, but if you just put it simply, reflection is learning from experience. If you just want to boil down to a simple definition, I would say reflection is learning from experience. Again, there are two more theories or definitions. Williams says that a theory of metacognition which directs skilled behavior during professional activity or assists in the deliberative process which occur during problem solving. Again, when we want to use it in homeopathy, it's not a simple skill. It's a metacognitive. That is, it's a higher order cognitive skill, and we use it normally during problem solving. And all of us know case taking is a very complex to some, easy to some, but a complex problem solving method. Milrod says reflection is also defined as a process of mirroring the environment non-judgmentally or critically for the purpose of decision making. Again, this is exactly what Dr. Hahnemann says. We need to be non-biased, non-judgment, unprejudiced observer of the patient and of the environment and come to a decision making. So this all reflects exactly what Dr. Hahnemann did during his primitive years of the formation or this of homeopathy. Reflective practice is learning by thinking about the things that we experience and looking at those from a different perspective, which helps them to take further steps. So when we have a experience, when we relook at it by reflecting on that experience and use it for benefit of that experience to enhance our learning, that process we call it as reflective practice or reflection. And I'm sure all of us have been using this reflection. So once we are introduced to the definition, I'll just quickly move towards the different models of reflection. because these are all scientific models. The easiest model is called as the ERA cycle. That is experience, reflection, and action. So what is this here? You experience a situation. Now, for us, the situation always, for us homeopathic consultants, primarily would be an experience or interaction with the patient. So it could be an experience in your clinic, it could be an experience at the bedside. So experience is the primary interaction, and then you reflect about that experience, and from the reflection, whatever you learn, you put it into action. That's a basic thing, that's called as the ERA cycle. That's a very basic model. Then we have something called as Driscoll's what model. So again, we think about the experience. What has happened during the interaction with my patient, during the interaction or while prescribing the remedy? What has happened? So, depending on what has happened, what was my action? Whether it was a positive action, whether it was a negative action, whether it was in our case as consultants, as homeopathic consultants. So, did it benefit my patient? If yes, then how did it benefit? If it did not benefit my patient, why did not it benefit my patient? And then now what? What am I supposed to do now? How do I change it? So that is called as the Driscoll's what model. You ask the question what after the experience, then you reflect, and then the answer you get, you use it for the benefit of that experience. You use it, in our case, it would be the best to the benefit of our patient, or to the benefit to give a proper cure or to select a right similar. Then we have something called as Kolb's learning cycle or Kolb's reflective cycle, in which you have, again, there are four normally there are three phases. In Kolb's cycle, we have four phases. It is the concrete expression or the concrete experience what you have. Then once that experience is over, you reflect over the experience simultaneously while observing. So in our case, we would be taking the case, simultaneously would be observing the case. That's one part of it. And then you abstract, you learn, you conceptualize certain theories from that, and then you do an active experimentation. And I probably think this is what Dr. Hahnemann has used. He had a experience while writing Cullen's Materia Medica. He reflected about it and he observed. Then he again he took the cinchona bark, he did many provings on himself, on his relatives, on his family members, and he observed what has happened. That is, it's just not observation. There's a huge difference between observation and reflective observation. When you just observe, you sometimes do not get anything from it. But when you reflectively observe, you derive some benefit from it. You understand the whole process, you evaluate, you analyze the process. And as homeopaths, it's very, very important for us not only to observe, but reflectively observe it. Then what did Dr. Hahnemann do? He abstract conceptualized it. He came out with theory, similibum curenter, likes cure like. He came out with a new theory. And then he did not stop there. He again experimented it and saw that it went on, and now that has given rise to a new system of homeopathy, which I think he has followed the Kolb's reflective cycle. This is what is my understanding. Then we have something called as a Gibbs reflective cycle, which is more detailed. You describe the situation, then you try to understand feelings. Here, the affective domain is brought into action. The feelings are taken into consideration. Then you evaluate it, you analyze it, then you conclude what is your understanding out of that experience, and then is action plan. In reflective observation, the end result has to be an action plan which is going to benefit your experience. So for us, definitely our second prescription or our follow-up is always that area or action plan where we reflect, we analyze our observation and interaction with the patient of maybe the remedy, maybe the potency what was given, maybe why we failed, maybe why the remedy worked, maybe how the patient, how we as consultants or practitioners perceived the case, what went good, what did not go good. All these things are something which we need to analyze, evaluate, and it is possible only when you do a reflective observation rather than observation. If you go into an organon of medicine, you would see n number of places where Dr. Hademan has so precisely asked us to observe. Observation, you will see n number of times we see the word observation, and that's so pivotal for us during case taking, because without observation there is no case taking, there is no complete case taking. It's very difficult to come to a right simillimum. But what I want to bring to my audience today is, it's not enough for us to just observe. It's a kind of reflective observation that helps us to find the simillimum. And probably there is the fine difference where somebody who is able to positively treat or get a success in a case, and somebody who is not able to get a success because maybe somebody is just observing without analyzing, and that becomes just mere observation. But if somebody is reflectively observing, probably your perception, your evaluation is going to a cognitive level, is going to a higher order level, and that is where your success for case taking lies in. That's how I interpret it. So this was the 4 different models, which are, we have n number of scientific papers in this, and these are the proven models which can be used for reflection. There's another reflective dimension, and this is called as the Donald-Schron's reflection. Here the reflection, we do it in 2 types. One is reflection in action and reflection on action. Now, what is reflection in action? Reflection in action is, it happens immediately. Now, for example, I am talking to you, and if all your cameras are open, I just look at your body language, I look at your the way you are responding, or probably, and then I change the way I am responding. So immediately I reflect on what I am able to sense and perceive, and immediately I change according to the need. That is reflection in action. So I am in the situation, we are reflecting, and that's so important for us during case taking, because as the case process happens, the patient is going on telling their story, and what is happening in your mind? You are reflecting in action. So all of us homeopaths, when we are taking our case, we are surely and definitely reflecting in action. Barring people who are just not listening, who are not present, who are absent during the, maybe they are not attentive during case taking, probably they are not reflecting. Otherwise, 95% of us are reflecting in action. That is what we exactly do. So we consider this the situation, and then we decide how to act, and then we act immediately by coming to a decision of giving a XYZ remedy. So that is reflection in action. So what happens? What's the benefit, or what happens during this? During reflection in action, on the spot reflection takes place. It involves thinking about what you are doing while you are doing. So while you are listening to the patient, you are also cognitively thinking and reflecting on what the patient is saying, why the patient is saying, and then you make your adjustment. It can help to make adjustment at the moment. You want to ask more questions if you are not satisfied about the aggravation, about the amelioration, about the causation. If you want to know the details of a particular remedy, if you want to go more into the mentals. So to differentiate the remedies, I think we use this reflection in action and can help you enhance your immediate performance. If you're not reflecting, most of the time, one of the advantage of reflection in action is your case becomes complete. Your case taking becomes complete, because you require a complete case So reflection in action helps you to complete your case by asking the questions which are so important for selecting the particular remedy. Next is reflection on action. Now this happens after the experience is over. Now the patient has come to you, you have taken the case, you have given the remedy. Now you go back and you think whether when you analyze the case or you want to reconsider the situation, or sometimes this also could be as a part of your second prescription or a follow-up. So you are again reanalyzing the case. Sometimes the remedy wouldn't have worked, or maybe the patient is not satisfied, or the symptoms are not getting well. So the second part during the follow-up, or maybe after the patient has gone, when you are analyzing, you do reflection on the action, on what you have done, you reflect. And for us to enhance our professional conduct, to enhance our professional development, and also to enhance our homeopathic practice, I think each one of us have to reflect on our action, however senior we are, however we have been practicing for years together. Because if a student is reflecting on the action, maybe he improves his case taking skills. But when seniors like all of you practice on the action, maybe we are able to add to the existing knowledge. There is something, because as you know, patients are changing, environment is changing, we have complex miasms which are coming up. So the same thing which was years back during the time of Hahnemann, or as progression has taken place, the diseases are changing, miasms are changing, and therefore the reactions also would be changing. So it could, when you reflect, you come out with new theoretical knowledge. Maybe you, as the a senior consultant, could add to the existing knowledge. And that is why it's so important for us to reflect on the action, on what we have done. So this is very important. And some of the benefits are, after reflection on action happens after an action or an event has occurred, involves thinking about what you did after it has happened, can help you make adjustments to future learning and action, can help you evaluate the reasons of your actions, and can help you develop an understanding of what you can do differently next time. So most of the time, so when you want to give your second prescription during follow-up, your reflection on action is really very important and very pivotal for us, because that helps us to know what would be our next step. So this was the basic understanding on the definition, the models, and how we have different dimensions of reflection, how we can logically or scientifically reflect. Now, during patient case taking, again, where can we practice reflection? It is for us homeopaths during our case taking process, as I told you before, and also during follow up or during second prescription. I was just going through this book, Principles and Practice of Homeopathy by David Owen, which was released in 2007. There he so well explains to us about reflection in homeopathy. Like all of us know, these are the basic things which have been mentioned in the book. That is what I have derived from the book. When we interact with the patient, or when we think about the simillimum, the different approaches all of us use would be a pathogenic. So say basically it could be due to some causative factor. Something is causing a particular this, and we give depending on the pathological cause. That is one of the simple approach which some of the homeopaths use. Another biological approach would be where you think about the symptom, the wholeness of the symptom, and symptomatic, you just treat the patient. That's another approach which maybe by some homeopaths are used in acute case taking. Like we know there are n number of approaches which we have used, but all are derived from the basic approach, which is the classical homeopathic approach. And then we have an holistic approach, like we use the totality of the symptom, we come to a constitutional approach, and then we treat. So that is sometimes when we want to give a constitutional remedy, you use the mind, soul, and the body. These are the three ways, or the vital force, the mind and the body. These are the three things. You try to correlate, you try to put the mentals, the constitution, and then there is this holistic approach. Then you have something called as holographic approach. A holographic approaches, there are some homeopaths who use the thematic approach. They come on the themes which are coming out, the essence of the story or the theme which the patient is coming out. That's another approach. And he talks about one beautiful approach that is relational, which I picked up because it's so much coinciding with my topic. Relational approach is you try to correlate the environment, you try to correlate the patient, his environment, his experiences, and your experiences. And that's how you relate things together. You reflect on each and try to correlate it, and then you come out on a remedy. These are the 5 approaches which have been mentioned in this book, Principles of and Practice of Homeopathy. I'll just go through few of the cases and see how reflective practice could be more helpful to each one of us. This I have already told you. When Hahnemann conducted the Cinchona Bark's experiences, at the age of 50, he published his reflection for the first time, The Medicine of Experience. And if we have had the experience of reading this Medicine of Experience, this is all about Dr. Hahnemann's reflections of what he observed, what did he reflect, and what was his analysis and evaluation, and how did he come to this conclusion of similia similibus curantur. To the homeopaths, the remedies we use are more than just remedies. They are just not remedies. They provide us the ideas and concepts that bring sense to what the patient is telling us. When I am trying to give pulsatilla, because the patient is having a weeping disposition, I'm trying to go more into the story. I'm just not looking at the patient. I am going to understand or conceptualize the patient's viewpoint. And that's only can be done when we have a reflective observation. I'll just go through one case. Seema, aged 38, had a small patch of eczema around her neck. Now, this was really irritating her. Having been present on and off for 12 years, she had the symptom. She used low-strength hydrocortisone cream to treat it, and although it had helped, its effect did not last, so she wanted to find an alternative. Around this time, the eczema started. She had taken a new job. The eczema was occasionally better in winter. In the past, she had noticed that she reacted with the skin irritation to some jewelry. So this is the case, and you get so many things. One is she has eczema. Second, she has taken homeopathic, allopathic treatment. Then the eczema started when she had a new job, and then it was better in winter. So there are so many things which are there. Now, reflective analysis. How can we reflect? What can we do as a reflective analysis in this particular case situation is, as at consultation, we may wonder whether her problem was due to jewelry allergy rather than a true eczema. That could be one of the way of looking at it. Or it could be due to her change at job, or there could be a stress related to job. So there are so many ways. On further inquiry, it seemed that it could be mostly due to an allergy rather than true eczema. So when we are taking this case, we are doing reflection in action. We are thinking that it could be due to jewelry allergy, it could be due to change of job, due to job-related stress. And then as I am going into deep, I do reflection in action, and to me it seems that mostly it could be due to a jewelry allergy. And so what do we do? We do not give her any remedy. We probably just ask her to, we give her some placebo, and we advise her to observe for the next 2 or 3 days and make sure that you wear a clothing below the between the skin and the jewelry, because your reflection in action tells you that mostly there is some kind of allergic related thing which is irritating her skin. And then once she comes back after a week, she says that because she has not been using, or the jewelry has not been touching her skin, her problem was reduced by 80%. And the problem was found to be an allergic or a contact dermatitis, where a remedy was not needed. It was just an indisposition. So when you have done the reflection in action, You realized that it has to be just a change in the way she is wearing a jewelry. That's just indisposition. So that is what Dr. Hahnemann tells us during classification of disease. Most of our cases are just indisposition where you do not need medicine. What if I would have given her a remedy which was not going to help her because there was an cause? The cause is already a maintaining cause, is already there. So there is indisposition. So we do not need to treat it. We need to change the cause, remove the cause. So this is how reflection in action really helped us. A core skill of an homeopath is to assist the patient in telling the story. At the simplest level, the patient's story is, I get the symptoms when this happens to me. This level of association by patient may explain the causes of many minor elements. Some of the best known and easiest to use homeopathic remedies are used to treat simple causations. So reflection in action really tells you what you need to do during that interaction and what will be your next step. It would be an acute remedy, it would be just giving a placebo, because, or it may be to dig down into a deeper level to remove a cause which has been suppressed. So many things could be the permutation and combinations. So you need to reflect during, or sometimes we are just listening but we are not reflecting, so you will just give XYZ remedy because that is how you just have perceived it. You have not reflected on what the patient is telling and why it is occurring. Another case I would like to just explain. A patient age 75 presented with chest pain following fall from a bike with her husband, who was riding the bike when she hit the car ahead. The wheel hit the chest, and it was exactly here that she first experienced pain. So the wheel of the bike hit her chest, and from there the pain started. Her husband's face was badly cut, which required a stay in the hospital overnight. The patient was very anxious, and because of this, the allopath prescribed some tranquilizers to help her sleep. When she came to our clinic, arnica was prescribed because she had some bruised wounds, and then she came back again for follow-up saying that the pain is not relieved and not much help was done to her. Although the pain was a primary problem, which we perceived initially, the problem was much deeper. For her, more than pain, it was the fear which was troubling her. And that we realized when we did reflection on action. We went back and we understood what happened, what mistake we did, and what was her problem. Her problem was not her bruised pain. The problem was, which was troubling her, is her fear with what will happen to my husband. Will he be cured? Will he go into complications, or a simple fall? It was just a cut, but that is how the patient was reacting. And later we realized that since the accident, she was frightened that something would help her, something else. She was frightened that something else would happen to her husband. For her, it was the shock that required treatment. And after taking the remedy aconite, she made a speedy recovery. So aconite was prescribed. Initially, we thought that it is arnica because it was the this. Of course, it would have helped her, but when she came back to us, she was not relieved with the pain, and she was like, we knew that she needed something else. This is how reflection on action helped us to change from arnica to aconite, perceiving fear to be her primary problem, rather pain in the chest to be her primary problem. So this is how we can reflect in action, reflect on action. So these were two case examples which I wanted to share to help us know how we can reflect in action and on action. There's another case. A patient age 15 presents with menstrual problem. Initially, she's very shy. At her second visit, she is more open and talks about her feelings. She responds to pulsatilla. A second patient, age 16, has similar problems. She also is shy and remains reluctant to reveal much about her personal life. She steers the consultation away from anything personal to do with her feelings, and she responds here to sepia. Again, here there is combination of reflection in action and reflection on action. So during my second prescription, Your reflection in action is occurring, and also simultaneously reflection on action about my first interaction with the patient is taking place simultaneously. So this is how we can use reflective observation to, we all do it, but maybe we can start doing it more logically and more scientifically. Now, how is reflective action very relevant in homeopathic practice? Reflection helps us, or it helps us in the perception of our case. When we reflect during our patient interaction, it helps us to perceive the case right. When you go back to our aphorisms, one of the primarily indications or principles of case taking is you need to perceive the case well, and that can aid, and reflection definitely will help us to perceive the case as required. It helps us, reflection definitely helps us on openness of the case. We can reflect on how open we are to case. Another principle what Dr. Hahnemann asks us is to be unprejudiced. And was I open during the case taking, or was I prejudiced? Was this the mistake done by me? Or maybe it was something which the patient was not able to tell. So you are very open to the case. And when you are open, when you are non-judgmental, you are unprejudiced, your case becomes more meaningful to us. Next important relevance is reflection on accuracy or completeness of the case. Most of the times when we go back into reflection on action and we look at our case papers, we see that so many important things are missing. And this is not for homeopaths who are experienced here, but maybe if somebody is there, a student here, this is very important, because when you look at your case paper and you reflect on that, you realize this is where I have gone wrong. And next time you can act on the action and see to it you are very accurate in your case taking. The completeness of your case taking is missed. So when you only know where you went wrong, that is where you can rectify your mistakes. But if you feel that whatever you're doing is right, you probably would not learn from your experience. Reflection on precision in listening. If you just remember, my last two talks have been communication in homeopathic practice. And I am able to, and one of the important component of communication we spoke in the last two webinars are listening or active listening. Again, there is a difference between just listening and active listening. And the difference is when I'm reflecting about what the patient says, I move from just listening to actively listening. And we have seen how important active listening is while communicating to the patient. And then reflection on recording the patients or recording the case history of the patient. I'm so sorry for the error in the spelling for patients, but this is how relevant for us reflection is in our homeopathic practice. What are the benefits for us? How? Now that we have known what is per se reflection, what is the definition, what are the models available, how scientifically we can use, when we have just tried to correlate it relevantly with our case taking and see how at different instances we can use reflection, how can we use this reflection at this era where we are waiting for to upgrade homeopathic practice? Now, I have divided into three categories. How consultants or senior clinicians can use reflection. When we are interacting with our cases, when we have so many solved cases, we have so many success rates, but we do not sometimes reflect on why. Why am I getting success in 200 potency or 1M potency, or what is the reason? When you reflect and you see, there could be some pattern, there could be some new theories which would come up, there could be something which you can enhance the existing knowledge. So when senior consultants reflect and make use of reflective writing. Reflective writing is a very, very used teaching learning method, especially since I told you I am into my fellowship in education. If you look at the NMC, all the other allopats, they are using reflective writing so much in clinical practice. And how is that going to use? That's reflective writing is altogether a different topic itself, but reflective writing helps you to analyze so many things, and sometimes it comes out, you come out with so many new ideas, so many things which you are not aware of, which you are routinely practicing. So out of 20, 30, 40 years of practice, you come out with so many new things, or also you are experimenting, or you are proving the things which are already mentioned by Dr. Hahnemann. So again, we are experimenting, or we are reproving so many things, and we are stamping that this is right. So this also helps us to increase our scientific acumen. And all of us, all the seniors present here, when you use these reflections and when you publish them, that becomes a scientific evidence in the era of evidence of practice. When we are looking for evidence based practice, your reflections are the core things which will help the budding homeopaths to reprove, or also logically we can, like, it helps them. Next is educators. How, if many of us are academicians here, it helps us in increasing our teaching learning methods. Reflective writing, when you are taking the clinical classes, when you ask them to use a reflective writing method for their case interaction with the patient, you come out with beautiful learning experiences by the students. So you can use reflective writing as one of the innovative teaching learning methods. It also enhances the critical thinking of the students, enhances the critical thinking of an individual, because here you are not only using your cognitive mind, but you are using your metacognition. So you are using your higher order cognition. So it enhances the personality development, it enhances logical thinking, it enhances critical thinking, and definitely it is an higher order teaching learning method. For students, how can students use this teaching learning method? To students, definitely it is like a bridge to correlate between the theory and the clinical practice. So what they have theoretical learned, like Dr. Hahnemann says in aphorism 71, that it's the knowledge, and it's also the application of knowledge which is important. And how do we apply? Our students learn the theoretical part, but when they sit in the clinic, they are supposed to correlate the theory with the clinic. And when you reflectively think, when you use reflection, this is how I need to correlate, that is how your clinical practice enhances, or you are able to correlate theoretical knowledge with your clinical practice. And this is how students can use reflective practice in their homeopathic practice. It definitely is one of the best and the proven method to enhance your knowledge. When you learn from your experience, there is no better learning. When somebody tells you, you learn. But when you learn from your experience, that becomes an lifelong learning. So that gets embedded in the students' minds. So these are the different ways where at different levels of homeopathic practice, homeopathic approach, we can use a reflective writing or reflection. So this is all about reflection. In short, I tried to, in today's webinar, just give you an overview about what is reflection, how in homeopathy practice we can use, and how we can enhance our homeopathic practice, or in homeopathy in general, by using reflection in a more scientific way. So thank you to all of you listening here, and I'm really indebted to the organizers for re-inviting me, and to all my participants for having a patient listen. Thank you.
Thank you, Dr. Jessica Monteiro. It's really an amazing performance from you, because nobody really know about all these reflections, but you show beautifully what is reflection, how it reflect and why it reflect, and what are the uses of reflection, and how one can utilize this reflection. For example, when a patient, you have demonstrated some of the cases also here, and for example, you have a patient in the right side and metromedica on the left side. So the patient face should be reflected the same with that in the metromedica. That kind of reflection need to be there. When we can call it as a simillimum. And that simillimum works 100% guarantee. That definitely give us a guarantee that the patient will be cured 100%. So that's the beauty of reflection, and the reading of the patient, the physician on the patient, and the reading of the physician on the materia medica. When you compare those things together, that will be the real picture. That will be really connected with the that will be the correct reflection in the materia medica. Then only the medicine will be similar. So it is the intense knowledge of the physician in reading these things. That's what that is the science of homeopathy. When applying this knowledge for the purpose of cure can be called as the art of homeopathy. So in the art of homeopathy, you need to connect both things together to get the result. When you really get the result, then that will yield that will boost the image of homeopathy in public. This is what I have learned from your presentation. So it is the time for discussion. Those who want to participate in discussion can raise your hand so that we will allow you to unmute yourself. I think Dr. Indani Bhavatkar is always there. Yes, you can unmute yourself and speak.
Yeah. Thank you, Dr. Jessica. It was a very nice presentation. It showed your deep study also, according in our homeopathic field. Some two small queries were there. See, now the reflection in action and reflection of action. This
Yes, sir.
can we say these two things are normal for a homeopath to react? Can we treat them, or should we think them in detail? Because we receive a case, and then we draw some conclusions, and we
Yes.
react according to it.
Yes. See, this is normally as a homeopath, it is a part of our art actually. Case taking is an art. It's a part of our art, and we normally do it. But if you want to theoretically divide it,
Then it is
reflection in action is different and reflection on action. So
is different.
yes, so that is what, like, if I am understanding your question right, you have asked me whether there is a difference between both of them. Is this what you are
No,
asking
no,
me?
no. My question is this a normal for a homeopath? Both reflection in action and reflection of action.
Yes, it is normal for an homeopath, but most of the time we do not put it into practice. It is it is not into active practice. We just do it half done. Maybe I just look at reflection on action, but when I do not think about it with reflective mind, then maybe I am not knowing where I am going wrong. I just think of it like, because if I'm following what went wrong, why it went wrong, then I come to a conclusion. But only if I think what went wrong, but if I'm not answering the question why it went wrong, then the reflection doesn't become complete. So there is something where most of us maybe are able to be successful and are not, half of them are not successful. Probably that's the silver lining.
Our organelle has talked about logic, like inductive logic and deductive logic. So can we apply here? Because inductive logic includes drawing general conclusions from a specific observation.
Correct.
That inductive, and a homeopath where he sees a deductive logic. So applying general principles to specific cases, and he draws some conclusion from it. So this is a deductive logic. So we can say this is a logical approach, or both logics are also involved in this process.
Yes, this is a part of reflection. If you go back to the models of reflection, for example, if you go to Kolb's reflective cycle, the third phase is drawing conceptualizing. There you derive the deductive or this, but before that you have to go into the analyzing part. If you do not analyze, you cannot go into conceptualization. So the inductive and deductive knowledge is a part of the reflective cycle.
It can be applied to it.
Yes, it's a part of the reflective cycle. So if you do not reflect, probably you will not come out with those logics.
Yeah, yeah. You have highlighted very nice points, and you have also answered the query very nicely. Thanks for your presentation, madam. Yeah, yeah, yeah.
Thank you so much, Doctor.
Yes, your demonstration also, for example, a case of pulsatilla was shown in a
Yeah.
beautiful way, and the reflection of the pulsatilla was there typically. And when in the second case of that same case is entirely different. That's the person is an introvert and is not revealing anything and indifferent at times, and that is the real picture of the patient. So the reflection on the other side is leading to sepia, and that's how sepia suit the medicine. So it is what one need is study things in a better way, understand proper understanding of veterinary medica, as well as the patient's listening and patient observation of the patient, so that you will get the correct image of the patient. So the image can be compared with the reflection, and then the reflection can be utilized for the correction of the selection of the remedy. Am I right?
Doctor, yes, very much right. And since I am into medical education, and I have been, like, in my batch, I think I'm the only homeopath, and we are 30 people of super specialists. From some of them are part of the NMC in the medical college. They are super specialists. I'm the only homeopath. I feel so happy. All the principles what are being talked there are already being was followed by Dr. Hanneman. That's one thing. But as an educator of the present today, I feel we need to teach our student not how to just take the case, but how to communicate. We need not, we are only teaching them how to take the case, but how to communicate is something which we need to again add to it. We are teaching them how to observe, but reflective observation is something which we need to add as we are progressing in this fast moving education race. So that's, as an educator, I think that is some fine tuning which we needs to be done.
Yeah, the teachers like you are really an asset to homeopathy, because this kind of teachers, they really run out of textbook and find out something new for homeopathy. So that's what we require at this time, because everything is growing, but homeopathy is also, our homeopathy need to grow in that way also, in the philosophy, giving more and more explanation to our philosophy. That is something great. It's just like our Dr. Kent, Dr. Kani Hussain, and all those fellows, Tyler, all they were doing. So the new generation doctors on the caliber of Jessica Monteiro is really an asset to homeopathy.
Thank you, sir. Thank you for your kind words. Thank you for your kind words.
Congratulations for that also. And now I invite Dr. Ramparesh sir to say a few words.
Thank you, Dr. Dhanesh ji. Everyone, namaskar and congratulations, Dr. Jessica Monteiro.
Thank you, sir.
Very, very thanks. Very nice presentation. Reflection of action. Knowledge, observation of case taking during many kinds of symptom, reflection of action during using benefit doctor, student, and knowledge. Oh, again, so very, very thanks, Dr. Jessica Monteiro. Thank you. Thanks.
No,
Thank you
sir.
so much, sir. It is really so motivating if I get such good feedback from seniors like you. It really makes us more indebted to you. Thank you so
Thank
much.
you. Thank you.
Now I invite Dr. Harihan sir to say a few words, as well as the vote of thanks to the session. Harihan sir, are you there? Yes, sir. Well, not responding. So I once again, it is up to Dr. Bhavat to say vote of thanks.
Yeah. Dr. Jessica, we are really very thankful to you. We are very happy to have you on this IFPH forum. These are things which are really very necessary. They should be at the UG level also. Like you are studying very at high level, I think postgraduate or PhD, and you have unfolded this reflection in action and of action in very simple words, and it is very definitely going to help us in our practice. So on behalf of our team of IFPH, We all are very thankful to have you over here. And I hand over the session to Dr. Dhanesh, sir. Yeah.
Thank you.
Thank you. Very, very thanks.
Thank you, Dr. Indrael Pavadkar and Dr. Jessica Monteiro, and those who attend the session. Tomorrow we will have a session from Dr. Suraj Singh Badoria, and Dr. will be talking about nanoparticles in the homeopathy. So with that, we come to the end of the day, 1637. 36. Thank you all.
Thank you. Good night and have a good weekend. Have a nice
Thank you.
weekend to all of you.
Thank you. Thank you. It's over to Dr. Mariamma John to moderate the Malayalam session.